Have you heard about vitamin D? Maybe some of your friends are taking it. Why is vitamin D so important, and do you need to consider taking a vitamin D supplement yourself? Today we'll be discussing the importance of getting adequate vitamin D daily. And if you stick with me until the end, I'll tell you why vitamin D may be especially important during flu season and a pandemic. Good morning, health-minded people. I'm Dr. Snow, and I help you treat minor health issues naturally. Also, I work with clients and their physicians to make sure they are on the fewest medications necessary to ensure the best outcomes possible. In my practice, I fill multiple prescriptions for vitamin D daily, and we have many customers come into the pharmacy to purchase over-the-counter vitamin D. So what's the big deal about vitamin D? You may have learned in school that vitamin D, also known as the sunshine vitamin, helps keep your bones healthy so that you don't develop rickets as a child. Well, you're all grown up now, so why should you be worried about vitamin D? It turns out that vitamin D is important to most of the organs in your system. It aids in the proper function of your digestive tract, your kidneys and lungs, your skin and bone marrow, in your reproductive organs, your pancreas, your muscles, and your brain. It protects against some cancers such as breast cancer and colorectal cancer. Also, vitamin D may keep your heart healthy and keep your blood pressure normal. And it plays an important role in keeping your immune system working properly. So you can see that vitamin D isn't just good for kids. If you have strong, straight bones, good for you. You got adequate amounts of vitamin D as a child, but now that you're all grown up, what may happen if you don't get enough vitamin D? You may be tired all the time without explanation. You may suffer from depression or have chronic pain, especially in your back. Bone loss, also known as osteopenia or osteoporosis, can occur, and you may have frequent infections which may take longer than normal to resolve. Also, you may have slow wound healing. Were you aware that vitamin D is so important to your overall health? If you're learning something new, please consider subscribing to my channel, and don't forget to hit that little bell so that you'll be notified every Monday when I post a new video that's designed to help you navigate the sometimes confusing healthcare system. So, who is at most risk of having a low vitamin D level? Studies have shown that 70% of the U.S. population have suboptimal levels and 28% are downright deficient. But if you have dark skin, you live in a northern latitude, you stay inside most of the time, you live in an area that has a lot of air pollution that blocks the sun, you have a condition that decreases your absorption of nutrients such as Crohn's disease or celiac disease, or if you have liver damage, kidney damage, or multiple sclerosis, you are at more risk of a vitamin D deficiency. Also, if you routinely take some medications such as laxatives, steroids such as prednisone or dexamethasone, seizure medications such as phenobarbital, phenytoin, or carbamazepine, anything that binds fat such as cholestyramine, cholesterol, or orlistat, and some HIV/AIDS medications including Inverase, Ryataz, and Sestiva. These can decrease your levels of vitamin D. While you must have a blood test in order to determine your exact vitamin D level, most people can benefit from increasing their vitamin D intake and should not rely on the amount of vitamin D your body makes on its own. Yes, vitamin D is made by the skin being exposed to the sun, but to get adequate amounts, and if you are very light-skinned, you will need to have 30% or more of your skin exposed in the middle of the day for about 15 minutes, 5 to 7 days a week. And if you are dark-skinned, this time needs to be increased to 30 minutes. And these times need to be increased even more in the winter because of the angle of the sun hitting the earth. I don't know about you, but I don't want to stand outside in my swimsuit for 20 minutes when it's 28 degrees outside. No, thank you. So what can you add to your diet to increase your vitamin D? Foods that contain vitamin D include oily fish such as tuna or salmon, beef liver, cheese, egg yolks, and foods that have been fortified with vitamin D. But you may also want to consider adding a daily supplement. Vitamin D is a fat-soluble vitamin, so you need to take it with food that contains some fat for best absorption. It is also stored in fat. The RDA, or recommended daily allowance of vitamin D, is officially 600 to 800 international units for adults, but recent studies are suggesting that this is inadequate. Scientists are recommending 2,000 units daily for most adults to maintain good health, but you shouldn't take more than 4,000 units daily unless under the direction of your healthcare provider, because you can get too much vitamin D. Side effects of too much vitamin D include hypercalcemia, or too much calcium in the blood. Symptoms of this include nausea, vomiting, constipation or diarrhea, stomach pain, confusion, extreme thirst, and frequent urination. Too much vitamin D can also damage your kidneys and cause bone loss. So once again, there is a happy medium when it comes to keeping yourself healthy. So what does vitamin D have to do with the flu and being in the middle of a pandemic? Vitamin D plays a crucial role in supporting your immune system. In fact, studies have shown that having an adequate level of vitamin D may decrease your risk of getting a respiratory infection by up to 50%. Respiratory infections that include colds, flu, bronchitis, pneumonia, and tuberculosis. And scientists are looking into whether or not low vitamin D levels may increase your risk of getting COVID-19 and developing some of the more serious complications of the disease. While the studies have been small and the results are not conclusive, it appears that people that test positive have lower levels of vitamin D, and those who develop respiratory failure are more likely to fall into the deficient range. This does not mean that vitamin D deficiency causes respiratory failure if you get COVID-19. However, it will be interesting to see what future studies show. What if taking a cheap supplement could lower your risk of dying from the flu, pneumonia, or COVID-19? Would it be worth $14 per year to possibly protect yourself from a deadly respiratory disease? If you have found this information helpful, but want more information on how to support your immune system, watch this video next. Thank you for joining me today to learn how important vitamin D is to your health. Stay healthy, eat your tuna, and have a blessed week.